The biggest barrier is that institutions don't see abortion as their responsibilities. They assume students will go elsewhere, that it's a private matter, that it's not an on-campus issue. But that assumption ignores everything: transportation, time, cost, stigma, and recovery. Schools don't build for what they don't believe they need to support. Abortion is treated like something that's rare, private, and external to campus life. But that's a myth. It happens here, on campus, in dorm rooms, in shared bathrooms, in private and shared spaces, both on and off campus. I've seen students navigating care in silence because no one built the system around them. No one considered birthing people when creating these health systems. The problem is that no one plans for it, and when institutions offer nothing but a referral link or a quiet mention during freshman year orientation, they call it neutrality, but it's not. It's a refusal to take action dressed up as information sharing. If a student can't access care because of a packed class schedule during operation hours or no car, that's the school's responsibility. Refusing to treat abortion like a basic health need is what makes it inaccessible.
One of the biggest challenges to implementing student-centered abortion care is pushback from administration. While students' involvement is crucial in shaping these services, it should not be their sole responsibility to navigate opposition from administrators, especially when it stems from legal concerns, logistical barriers, or financial constraints. Additionally, students advocating for reproductive health access already face social stigma and moral pushback, making it unfair to place the burden of overcoming institutional resistance on them. Instead, universities should take the lead in addressing these challenges, ensuring that abortion care is accessible, student-centered, and free from unnecessary obstacles.
I worry that the stigma some people place on abortion could weigh more than the benefit of providing student-centered abortion care on campus. The Guttmacher Institute reports that more than half of pregnant people obtaining an abortion are in their 20s, which is the typical age range of young folks attending college and residing on campus. University administrators may resist providing this essential health care to avoid controversy, donor backlash, or negative publicity. At the same time, anti-abortion organizations could protest and pressure the school to block this service. For many students, an unintended pregnancy can derail their career trajectory, and universities must provide support to achieve their goals.
A key factor in implementing student-centered abortion care is strong support from the campus student health centers. Since these centers are responsible for administrating reproductive health care, they must be well established and their full backing is essential. To be truly effective, these services must be well established, adequately funded, and easily accessible, meaning they should not have to go to external providers. This implementation should require the medication being directly provided by qualified providers within the student health services. And beyond clinical service and clinical support, we need additional support from campus research centers, student advocacy groups, and administrative leadership. Then this plays a vital role in implementation for abortion care.
The greatest barrier to student-centered abortion care is the exceptionalization of abortion that creates a sense of trepidation around the service for healthcare providers and college administrators, when care like IUD insertion and pap smears are already provided in campus clinics. Further, the lack of communication between administrators, health providers, and students can result in implementation of policies that are ineffective, inaccessible, and confusing to students. Student-centered care must be gender-affirming, sensitive, and transparent so that students can feel supported through every step of the process.